You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start Grant. And with me today is Monica Ptacek and Grace Stanton. Good morning, Monica.
Good morning, Dana.
Good morning, Grace.
Good morning.
Now, Monica, could you I know you work for Parents as Teachers, Early Head Start. Could you tell me a little bit about what you do for that organization?
I could. I am the health coordinator. I started with the Parents as Teachers Early Head Start program about 10 years ago. And at that time, we were just starting the Early Head Start program, so we've seen 10 years of growth. I am responsible for all the hearing and vision screenings that are done on our newly enrolled children and monitoring all of their health requirements.
Now, today you're going to talk to us about hearing screenings, and Grace is going to help us out with that. So, could you tell us a little bit more about the hearing screenings that are available for children in our community?
I would be happy to. The hearing screening that we use is called the OAE. And, you know, whenever you work in any profession, you start using
lots of
acronyms.
Yes.
That stands for otoacoustic emissions.
OAE is easier. Yes.
Much easier. So we always refer to it as the OAE. And what it is, it's this handheld portable device that we can do a hearing screening with. It has a microphone here. The sound travels through the microphone and to the probe tip. It sends out a frequency that's similar to what you would use for language development. So it's checking that children can hear in those frequencies. It sends the sound in, and then it measures the echo or the return of the sound coming back. So it is a really nice screening tool because in the past, what they did with hearing screenings was they would stand behind the child, they would ring a bell, they would have a block in a cup and shake it. And those were very subjective. It depended on how loud the person doing the screening did it. They just simply watched for a response from the child. All this requires is that the child is quiet, because if there is a lot of noise in the room or the child is upset or crying, then of course that echo can't return. So other than that, if the child is distracted and quiet and doesn't notice that the probe is even there, then the screening only takes about 30 seconds.
Now, is there a certain age a child has to be before they can do this?
Actually, this is the same screening that is done for newborns when they have their newborn hearing screening. And so it can be done actually on any age. They also use this same screening for children who have maybe communication problems or aren't able to do the hearing screening that's traditionally done in school with the raising their hand for any number of reasons. So they have probe tips clear up for adults.
Okay, now say you have a screening done for your newborn. Is that the only screening test that they will need? Do they need another hearing test as they get older?
The vast majority of children in Kansas do go through the newborn hearing screening. And statistically, research tells us that about 1 in 300 children is going to be diagnosed with a significant hearing loss. So it's important that that screening take place as soon as possible. And oftentimes people think, well, my child passed that screening, we're good to go. But research also tells us that by the time those children are school-aged, that there is going to be an additional 6 in 1,000 children who have a significant hearing loss. So just because you're identified as okay at birth does not mean that there isn't some kind of a progressive hearing loss or a hearing loss that's going to occur early in childhood.
Great. Now, some people would say, well, can I just wait till school starts and then the school system will take care of that? Is there a benefit for a very young child to have this screening?
There certainly is a benefit, and traditionally that is what has happened, is that children have been around the age of 5 before a hearing loss is identified. Well, we know currently from research that the greatest amount of learning takes place from birth to age 3. And language development at that age is absolutely phenomenal. So if children are missing out on that window of opportunity, they can't help but have delays when they enter school.
Might be too late.
Yes,
5 years old
right,
would be too late.
Right.
Yes.
Well, certainly it puts them at a disadvantage. So the earlier that this can be detected and treated, far better for the child. It makes it much easier for them to stay up with their peers and to have that school readiness that all the other children that are age 5 entering school have.
Good, good, good. Now, can you show us today how to do one of those screenings?
I'd love
now,
to.
on the way here, Miss Grace wanted to know, will it be like a shot in my ear?
No. We will be happy to demonstrate. First, I have a hand wipe here. I'll clean my hands. So that's for my hands. You don't have to worry about it. And then we have really soft foam tips that go at the end of our probe.
Not like a shot.
Not at all. In fact, earlier I let Grace feel one so she could see how soft they were. It just slides on the end. Turn the machine on. And then there's a little clip here because this microphone is kind of heavy. So that just makes it easier. So I'm going to move your hair back, Grace, and clip it right here to your dress. And then we squish, squish, squish this tip so it's nice and soft. We put it in your ear, just like that. And all we do is push the button. Oh, it didn't get in. You have little ear canals. Leave it alone. There you go. It's going. And you can see it just measures at different decibels. And we got a pass.
You passed.
You passed, and that's as easy as it is.
Now, if someone is interested in having their child get a hearing test, who do they contact? Is there a number or an organization?
Yes, they could contact our office at 623-2440. And Rachel is our administrative assistant, and they could just tell her that they were interested in scheduling a hearing screening or an OAE, whichever way they want to phrase it. And there are 3 people at our office that are trained to do these screenings, Michelle Daniels, Jana Pfeiffer, and myself. So one of us would then contact them and see what works for them. We're happy to come to their home to do it.
Wonderful.
Or if it's easier for them, we can meet them at the office and they can do it there, whatever works best for them.
Well, thank you so much for the information. Thank you, Monica. Thank you, Grace. You've been watching You and Your Young Child, the program devoted to early childhood. And remember, parents, you're your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry.